From observation of the natural tooth, it can be understood that the color shade varies in different areas. The internal stain technique attributes strongly to reflect these complicated patterns naturally. This internal stain technique was first developed by Mr. Aoshima in 1986. To reflect the complicated color shades of a natural dentition, the multicolor buildup technique is to insert the modifier between body and enamel. But this method is so difficult that it requires many years of experience by dental technicians. Of course, there are other easy methods of applying external stain, but they lack the reflection of a permeable color shade. Thus, we are led to focus our attention on the internal stain technique. To fulfill this technique, Noritake developed its internal live stain. Now let's look at the features of internal live stain. First, no bubbles occur. Previous stain may cause air bubbles during baking. Look at the test pieces. The test pieces are the completion after 3 cycles baking of body, stain, and translucent porcelain. A and B are the test pieces of previous stain. Apparently A and B show vast occurrence of microporosities. The reason lies in the incompatibility of thermal expansion between the interface of stain and body or translucent layer. Thermal expansion of previous stain reaches only 1/2 of that of body or translucent porcelain. Therefore, a gap occurs between stain and body or translucent layer during porcelain baking, and this accounts for the porosities. Internal live stain shows approximately the same thermal expansion as that of body porcelain. Contrary to the above, no bubbles occur in the test pieces of internal live stain. The second feature is that internal live stain shows the same white-blue fluorescence as that of body porcelain. Summarized from detailed research of natural dentition tooth, internal live stain provides a wide variety of color shades. In the case that there is no sufficient space for porcelain buildup, internal stain application on the opaque can cover the permeation of opaque color effectively. Simply with 1 layer of stain, color shade is simulated easily. Now let's move on to the application of internal live stain. This stain is applicable on the 3-layer buildup of body, enamel, and translucent porcelain. After the baking of opaque, we build up with body and enamel of the same shape and same size as that of the symmetric tooth, then go on baking. Grind a thin layer of the surface with the carbon random point and figure out the mammalian structure with a disc wheel. After the ultrasonic wave cleaning, coat it with internal live stain. The coating is applied in 2 steps. First, in the horizontal direction, in other words, the staining in mesial and distal direction. After the baking of the first coating, coat the stain again in the vertical direction, in other words, the incisal cervical direction, and then go on baking. After the baking of internal live stain, build up and bake the translucent porcelain, and then proceed with the morphological correction and glazing. Now we have a few words about the application of internal live stain. Internal live stain is specially prepared in accordance with internal stain technique. Please note that it can be used only as internal stain. Do not mix internal stain liquid with water because of its indissolubility. Remove the stain adhered on the brush with tissue paper. And the liquid may dissolve plastic materials. Be cautious about applying it to plastic materials. Use the indicated stain liquid only. Avoid any cross-use with other makers' materials. Now let's review the clinical cases of internal stain technique. This case shows the shade reflection of a middle-aged person. Fabricate the ceramo-metal crown for the maxillary central incisor. Then bake the opaque. Before the buildup of margin porcelain, coat the shoulder of the die first with margin separator A, and 1 to 2 minutes later with separator B. Before the drying of separator B, build up margin porcelain and condense it with the appropriate instrument. Remove the excessive margin porcelain with a spoon-like instrument. Polish the surface smooth with a bigger brush, remove the metal framework from the die, and go on for the first baking of margin porcelain. Hold the margin porcelain at the table of the porcelain furnace for 5 minutes for drying. Bake it from 1202 degrees to 1733 degrees Fahrenheit. Because of the baking shrinkage of margin porcelain, to some extent a crevice might be seen on the margin part. Then go to the second build-up and second baking. The second baking follows the same program as that of the first baking. Here is the finish of the second baking, which shows excellent fitting. Look at another case. Because of the thin porcelain layer on cervical, internal stain is applied on margin porcelain. Mix cervical 1 and cervical 2 at a ratio of 1 to 1, and then mix it with internal stain liquid. Coat the mixed stain over margin porcelain. Coat the internal stain at the joint of opaque and metal. In this way, the permeation of opaque color can be covered. For the baking of internal live stain, first dry it at the table of the porcelain surface for 3 minutes, and then bake it at normal atmosphere from 1293 degrees to 1525 degrees Fahrenheit at the rate of 99 degrees per minute. The stain is baked solid onto the opaque and margin porcelain. Mix the body porcelain with forming liquid. Build up the body porcelain on the cervical and proximal area. Then insert the metal frame into the working die. Build up the same shape and same size as that of the symmetric tooth. Go on for the cutback from the proximal surface. Cut back about 0.5 millimeters on the incisal edge. Cut back the incisal 1/3 on the labial surface. After cutback, check for sufficient space for enamel buildup. Form the mammalian figure. Make the tip of the wet brush sharp and smooth out the mamelon structure. Then check again the proximal surface and the incisal 1/3 on the labial side for sufficient space for the enamel. Build up enamel porcelain on the cutback area and ensure approximately the same shape and same size as that of the symmetric tooth. After the buildup on the labial surface, remove the metal framework from the die. Build up enamel porcelain on the proximal surface and condense it slightly. Cut off the porcelain cleanly from the incisal edge on the lingual surface. Slightly smooth the surface of porcelain with a brush, and here is the finish of body and enamel porcelain buildup. Inspect the inner side of the metal framework for porcelain excess. Carefully remove any porcelain contamination with a small brush. Dry the body and enamel at the table of the porcelain furnace for 7 minutes and then bake it from 1112 degrees to 1706 degrees Fahrenheit at the rate of 81 degrees per minute. After baking, place the metal framework on the die and check if the space for translucent buildup is sufficient or not. In case of insufficient space, get rid of the excessive buildup with a carbon random point. Grind off one layer of the surface to strengthen the compatibility with translucent porcelain. Cut the incisal tip 0.5 millimeters shorter than the tooth on the opposite side. Grind off one layer on the lingual surface with a carbon random point. Smooth the margin and the joint of metal and porcelain with a carbon random point carefully. Then apply the sandblast slightly with 50 micron aluminum oxide. Place the metal framework into alcohol and clean it with ultrasonic wave for 10 minutes. Before the first application of internal stain, wet the whole porcelain area with internal stain liquid. Confirm the position of the transverse groove before staining. The white line is made up of a mixture of white and bright at a ratio of 1:1. Remove the metal framework from the die and extend the white line to both the right and left side of the proximal. Coat the cervical with a mixture of cervical 1 and cervical 2 at a ratio of 1:1. Apply cervical 1 between the white lines slightly. If necessary, paint the cervical 1 onto the middle 1/3, which will emphasize the white line appearance. Paint cervical 2 from the incisal and extend to the lingual surface. This illustration shows the completion of staining in the horizontal direction. The white line is presented by the mixture of white and bright at a ratio of 1:1. And for the cervical, a mixture of cervical 1 and cervical 2 at a ratio of 1 to 1 is applied. Cervical 1 is minutely painted between and around the white lines. Cervical 2 is minutely painted around the incisal part on both the labial and lingual surface. Now we move on to the first baking of internal stain. The baking runs from 1293 degrees to 1525 degrees Fahrenheit at room atmosphere. Here is the completion of internal live stain baking, which shows no luster on the stain. This step is mainly intended to settle the stain firmly. Then we will go on for the second staining, in other words, the staining in the vertical direction, for which we will show you the illustration in detail. Mix incisal blue 1 and 2 at a ratio of 1 to 1, and then mix again with a little bright. Apply the mixture around the mesial proximal. At the distal, apply the mixture of incisal blue 1 and 2 at a ratio of 1 to 1. For the enamel black fracture, apply the mixture of white and mamelon orange at a ratio of 1 to 1. Before the second staining, also wet the surface of the porcelain with internal stain liquid. For the proximal around the incisal, apply the mixture of incisal blue 1 and 2 at the ratio of 1 to 1. For the enamel crack line, apply the mixture of white and mamelon orange at a ratio of 1 to 1. Use a small brush for the painting of the fracture line. Any excessive stain of the lines can be removed by a small brush from both edges little by little. On both the mesial and distal sides of the proximal part, if the incisal blue 2 is decorated next to the enamel crack line, the enamel crack line can be presented emphatically. The second baking of the internal live stain follows the same program as that of the first baking. After the baking, confirm the color shade by wetting the surface with internal stain liquid. Insert the metal framework in the die for the buildup of translucent porcelain. Build up 10% larger than the same tooth on the opposite side. The baking of translucent porcelain follows the same program as that of body and enamel porcelain. Now we come to the contact adjustment. First, mark the contact adjacent teeth with a blue pencil. Insert the metal framework in the die. Adjust the contact of porcelain with a carbon random point. Adjust the occlusal surface of the maxilla and mandible. The occlusion should be adjusted in all positions, as centric occlusion, anterior guidance, and lateral guidance. Next, we come to the morphological correction of the crown. Adjust the contour on the labial side according to the symmetric tooth with a carbon random point. Select a small carbon random point and dress the tip sharp with a diamond dresser. Polish the cervical and interproximal surface with this point. Polish the joint of metal and porcelain clean so that no porcelain remains on the metal. It is especially important to polish the disto and incisal angle most carefully. Mark with pencil on the model the rim contour of the mesial and distal side. The extreme surface texture should also be marked. The mesial and distal marginal ridge are formed in the vertical direction, and then the carved lines are diffused in the horizontal direction by the vibration of the point. After the forming of the marginal ridge, dip cotton into dry well and wet the porcelain surface to check if the forming is finished naturally. Contour any roughness away with the carbon random point until it appears compatible. Next, the forming of surface texture. The same as above, wet the porcelain surface with dry well and check the position on the die. Now the cervical depression is formed. For the whole surface texture, extend to the mesial and distal proximal area. Adjust the extreme contour part with a carbon random point. Finally, smooth the whole surface with sandpaper. Especially polish carefully the cervical, contact, and occlusal surface. Place it on the die for reconfirmation. Use the carbide burr inverted cone to grind smooth the enamel crack line with a slight touch. Clean with ultrasonic wave, and if necessary, go to the external staining. To maintain the surface features gained during morphological correction, polishing is applied to get the final luster. Therefore, the glazing is set 68 degrees lower than that of self-glazing. The pearl surface has been developed as the grinding material for porcelain luster. Pearl surface C is offered as medium polishing and F is offered as general polishing. The polishing is available by the application of grinding materials on the felt wheel included in the set series. Put the pearl surface C onto the felt wheel for lathe grinding. Change pearl surface C with pearl surface F onto the felt wheel for continuous lathe grinding if there is a little luster appearing on the surface. So far, we have completed the porcelain margin ceramo-metal crown using the internal stain technique. The complicated color shades are simulated precisely. Before we close, let's have a view of clinical cases with the application of the above technique. The left lateral incisor has been restored. The prosthetics well simulate the complicated color shades. Look at the right central incisor and lateral incisor. It shows exactly the configuration and color shade for a middle-aged person and match with the adjacent teeth. Here is another case for the two central incisors and the two lateral incisors. The configuration has been well restored and the color shades are reproduced bright and vivid. We really appreciate your evaluation of the technique, and it is our hope that it will be a help for the improvement of dental techniques and will be the best prescription for patients to regain their smiles.